We're going to spend the rest of today's episode talking about Huntington's. In September, I reported on the first ever treatment for the disease with data showing that Huntington's was slowed by 75%. Now, this disease is cruel and devastating. It runs through families, relentlessly kills brain cells, and it resembles a combination of dementia, Parkinson's, and motor neuron disease. Now, this treatment was an experimental gene therapy delivered into the brain during hours of delicate surgery. The therapy reduces the production of the toxic protein that's behind Huntington's. The announcement of the results of the trial was probably the biggest health story of last year, and for the first time, I want you to meet the people on the trial and the team that delivered the therapy.
Hi James, welcome to Cardiff. We're here in the MRI scanning suite in Cardiff University Hospital. I'm Liam Gray, I'm the Professor of Neurosurgery here.
Liam, thank you so much for inviting us in, because this is the place that pioneering Huntington's disease therapy took place, isn't it?
Yeah, absolutely. We did all the UK surgeries, and we're one of the few places in the world, there's only 2 in Europe and maybe 4 or 5 worldwide, that are doing this type of surgery at the moment, yes.
I'm going to go through the detail in a minute, but can I fast forward to the end? What was your reaction? How did you feel when you realised that this was working and actually was the first time in Huntington's disease that you were changing the course of that devastating condition?
Oh, it was, it was an emotional reaction, to be honest. We've been trying for 50 years to try and find a cure for this disease. There have been many attempts, and suddenly the needle has moved, and this study has shown that it is possible to slow the progression of this disease, which I think is absolutely amazing and very emotional for everybody involved.
Right. This is a substantial and delicate piece of surgery in order to do it. Just walk me through the process, because it's well over 10 hours of surgical time, isn't it?
Yeah, I mean, for this study and these types of studies, I think the average was about 14 hours for this surgery. So this surgery is quite different to what we normally do, in that we normally operate in a standard neurosurgical theatre, but all the surgery is done in an MRI scanner.
Just paint the scene for me of what it's like doing that surgery inside an MRI machine, because I picture that as like you're going through like a thin tube.
No, the participant is going through a thin tube. If you look at an MRI scanner, when people get into a scanner, you lie on the table and you go in. Actually, there's an other end that you can get out through as well. And the patient's head comes out through there, and we do all the surgery at the back of the scanner.
And then does the patient go back in and out in order to know that you're in the right place at the right time?
Exactly, and the patient gets scanned continuously during the whole procedure.
Why are they having to be in an MRI machine? Because I've witnessed other brain surgeries, and what often happens is you have the MRI scan beforehand, and then that's enough to operate on.
Because we need to be able to see the infusion in real time. The catheters that go in to deliver the therapy, they're movable, so we need to advance them, and we can adjust the flow rate. You need to get some feedback, watch how it's going. These therapies can reflux back up the catheter, they can leak into areas you don't want them to leak into, and you need to be able to see this in real time.
And how precise do you have to be? Does the therapy have to get to one very particular part of the brain, or is it enough to just kind of get it in there?
No, it's not a general spray paint job. You have to get it exactly where you want to get it. Yeah, so these target structures are quite small. They're a few cubic centimeters in size, and we have to fill them maximally as well. So it's not just getting it in there. We need to be able to fill as much of the structure as possible.
And Liam, is that the MRI machine we can hear beeping away in the background?
The very one, yes. This is one of our 3 Tesla machines here, and that's the one we do all the surgery.
What is the bit of the operation that takes so long? Is it because you have to be very delicate with putting the infusion into the brain, or is it the lining everything up?
Well, I think both, to be honest. I mean, the infusions are slow because if you infuse too quickly, you'll cause damage. But the major part of the surgery is making sure that the catheters are getting to the right place. And to do that, we have to make lots of measurements and lots of adjustments.
And this therapy, it's kind of like a combination of gene therapy and gene silencing technologies, isn't it? Because you're trying to shut down the production of the toxic protein that kills brain cells in Huntington's disease.
Yeah, so in Huntington's disease, there's a protein called Huntington, and these patients have an abnormality in the gene, and that makes the protein misfold, and then it appears to have some toxic characteristics. So this therapy is knocking down the production of this either total protein or the mutant part of the protein, depending on the therapeutic that's used.
And this was a huge amount of work for you, but it's also a really big thing for anybody that was volunteering to take part in this research, not knowing that it would be the first to show that it worked.
both I and the team have huge admiration for these people. These are courageous people who are taking risk up front to have a therapy that might do them harm. It might have no benefit whatsoever. They are undergoing brain surgery and they have no idea whether there's going to be any benefit. When I operate normally for the other types of neurosurgery that I do, there's always a benefit. There's a risk, but there's always a benefit. In this situation, we don't know there's any benefit, and these people are really doing experimental medicine and are hugely courageous to do so.
Well, now I want you to meet Gareth, who's one of those who volunteered to take part in the trial. He has Huntington's disease, and it runs through his family.
My paternal grandmother passed away with Huntington's. Her sisters all had HD, different levels, different symptoms. Now, further on, my aunt developed it probably about 20 years ago and has been dealing with it.
Just for people that aren't familiar with Huntington's disease, just describe what it is like and what the impact that it does have on some people who can be really severely affected.
Well, there is the involuntary movement. Speech is affected. Some memory, cognitive issues. It gets progressively worse. There are potential anger issues, but there's an ambiguity to HD, and it's inevitable. However, it's extremely unpredictable. If I introduce you to 10 people who've got it in their families, and each one would have a different story, different symptoms, different rate of progression.
And Gareth, I appreciate this is a personal question, but did you choose not to have children because of Huntington's disease?
I would probably say yes, in that I made a conscious decision not to want to pass the gene on. Now, that was my personal decision. I have a lot of friends I've met who are a little bit younger than me, just got married or new relationships, and that question is coming up to them. And it's a decision they have to make.
What made you decide to volunteer to take part in the trial? Because
yes,
at the very beginning, it's experimental medicine. Well, nobody knows what's going to happen.
Yeah. Now I'm someone who doesn't even like a blood test, so this caught a few people by surprise when I said I was doing this, and I've showed them the photographs since. Really,
I don't like a blood test, but I'll do 14 hours of surgery, that's fine.
Yes, but I thought I was in a unique position. I don't have children. So this seemed to me as if it was innovative and hopeful of something that was to be bright at the end of it.
Just walk me through the day itself then, Gareth. What happened?
Well, one of the nurses woke me up quite early. I was delivered my kind of gown, etc., which really, there was no turning back. So I went to get myself changed, quick chat myself in the mirror. I was introduced to the team. What was kind of surprising, I think, was the anaesthetic. It was a countdown, 3, 2, 1, and the next minute I woke up surrounded by faces, and I was off to the intensive care unit for a few hours. I think I was out of the bed within 24 hours. I was out of the hospital within the week.
And how are you today, Gareth?
Feeling pretty well. Now, I'm not going to say that's anything to do with the trial process. I would hope it is, but I wouldn't be foolish enough to say that.
Jane Davies, the lead nurse of Advanced Neurotherapies at the University Hospital of Wales, has been side by side with Gareth throughout the trial.
I'm in a privileged position where I get to know the Huntington's disease patients and families from a very early stage, from when they're just diagnosed, and then we see them on a yearly basis over many years, and you see the different challenges that they face throughout the course, progression of the illness and family dynamics, etc. So when there is that little glimmer of hope, they really, understandably want to grab it.
Is it quite emotional?
Absolutely, yes, yeah. You, as a research team, we live the trial with the patients. You have to, we have to be there with them every step of the way. It's a huge undertaking, with sort of huge emotional, psychological weight, making a decision to take part in one of these trials. I've been fortunate to be with Gareth right from the very start of his research story. So I've worked with him since shortly after he was diagnosed. I was the first person to sort of approach him about the trial and say, look, I think you are, a possible candidate for this. How do you feel about that? I was there for his surgery. And then when we woke him up, I spoke to him, and the first thing he said to me was, oh, hi, Jane, and when someone's been through neurosurgery, and they wake up and they know you straight away, it's obviously a huge sense of relief, and just so pleased for him, really.
And I asked Jane how she felt when the results were announced.
I felt really, obviously, really encouraged. But for me, being involved in the research, there's still a dose of realism with regards to that. After that day, for me, my workload increased considerably because so many patients were getting in touch. I want to take part in this trial. What can I do? I'm desperate. Not just from Wales, not just from our clinic, from all over the world. People getting in touch. Can we come? We'll move to the UK if we can take part in this trial. Emotionally, it's been a difficult time dealing with that. And, there's some heartbreaking stories that you hear, so... But, there is hope, and you can't, this is the very positive thing to come out of it.
The headline results of the trial were impressive. A 75% reduction in the pace of the disease means the decline you would normally see after 1 year would take 4 years after treatment. Here's Surgeon Professor Liam Gray again.
It's a really meaningful difference, absolutely. If we can intervene early and slow down the progression of this disease to that degree, we do have to be aware that we need to know how long this effect will last for as well. So obviously it's early days yet and we don't know, but we've no reason to believe why it won't.
And how do you know that it was a 75% reduction in the progression of the disease?
Well, in this trial, we compared the progression of the disease in the participants who had therapy to a very, very tightly matched population who were matched for the severity of the disease, etc. And therefore, by looking at them over time, we can see that the patients who had the therapy appeared to slow the progression of the disease by 75%.
Liam, when I reported on this last year, there was a lot of excitement that this might come to people quite quickly and be available as a treatment. There was a lot of talk about getting approval in the United States within months. That hasn't happened and doesn't look likely to happen soon now.
Yeah, I think each country is different, and I think what happens in the US is not necessarily applicable to what happens in the UK. But each country has its own regulatory authority that will license this therapy once they think it's safe and it's effective. So that's a process that is taking place and will continue to take place.
It's a really hard time, though, isn't it, for families who may have seen a parent or grandparent die from Huntington's disease, maybe in the earliest stages of it, think that they have passed the gene on to their children, to know that there is something that actually the science suggests would make a massive difference, and it's not available.
It obviously isn't easy if you have the condition and if your family have or may have the condition, but it really is in everybody's best interest that we know that it's safe and that it's effective.
There have been some questions about how useful this therapy will be because of the amount of surgery that is involved and the highly specialised centres. Like, this is the only place in the UK you could do this, right, Liam? So, is this a therapy for everybody with Huntington's disease?
It may not be a therapy for absolutely everybody, but it is a therapy that can be scaled up. So you must realise that we're now at very early stages where we're trying to prove as best we can that this therapy is effective. Once we know that, then we can work on making the whole procedure shorter, faster, more effective. And really what we're looking at is moving this towards really a day case surgery where somebody will come in either the evening before or the morning of, have the surgery, have the therapy delivered, and be able to go home in the evening. So it is scalable. It's just right now we're very, very early in the genesis of the whole evidence to show that it works.
Liam Gray there. Now, I asked Gareth what his hopes for the future were.
Well, apart from Chelsea winning the Premier League, it would probably be for HD to be cured finally. I know that's still a way off, but it's one kind of step at a time, and advanced therapy is a great future initiative.
Thank you to Gareth, Liam, Jane, and to all of you for listening to the Inside Health podcast with me, James Gallagher.